Welcome everyone to yet another series of discussions that we have under Visionaries Unplugged, a series of candid interactions that we have with our VOH incubator mentors and advisors. Today's discussion we have tweaked towards how are we integrating AI in medical imaging. And although that's a little technical to begin with, we'll also be discussing about how our budding entrepreneurs and founders who have a deep niche in it can look at, diving into a business. And to talk about it, I have my guest today with me, Mr. Kabir Mahajan, who is the Associate Director at Mahajan Imaging Labs. Welcome, Kabir, to this discussion. Thank you so much for being here. Now, Kabir has been very closely seeing and witnessing how VOH Incubator has been placed since last 7-8 months. Kabir has also interacted with a couple of our startups, and just to understand how the brains are working these days in terms of founders and the budding entrepreneurs. So, Kabir, just I mentioned, these discussions are built in a way so that we can cater our budding founders, maybe somebody who has a tip in working in medical imaging AI, and how can they build their business in that. So, we'll be just talking about that.
Sure.
Right, so before we talk about, Kabir, how, everything ended up, how is AI working these days and how is India looking at technical imaging? I'm sure that there's a past behind before you entered and navigated into Mahajan Imaging Labs. Now, academically, you are an MBA, then you dived into healthcare, and then you dived into Mahajan Imaging. So, how do you sum up the years of experience that you've gathered around the world?
Sure. So, thank you for having me. It's truly an honor to be here.
Sure.
So, just to start my journey, my father is a radiologist who is the founder of Mahajan Imaging, and my brother took up medicine, but I somehow was right from the school days never really interested in science as a subject. So commerce was the option that I opted for in class 11, and I really enjoyed business studies. I really enjoyed finance and marketing, and that's been my journey and my role in the last many years that I've been in healthcare. After completing my graduation from Delhi University, where I did my BCom honors, I spent some time with a consulting firm in the transaction advisory. So that gave an overall flavor of mergers and acquisitions and private equity. So that was a great experience. Post which I studied a bit more, did a diploma in international marketing again from Delhi University. Thereafter, I joined Mahajan Imaging for about 4.5 years, where I was, apart from the daily finance and marketing related matters, I was setting up the research division of Mahajan Imaging, and along with that, I set up a joint venture with 𝐔𝐻𝗹𝗏 for education. 2016 is when I went for my MBA to the IAC Business School in Barcelona, and there between the first and the second year, I met up with a very interesting, innovative company called 𝗀𝗵𝒻, who were working in the field of artificial intelligence in radiology and oncology. So that was a very exciting startup, and it was a perfect fit given the radiology background I had. So spent a summer doing an internship there, and post my MBA, while I had all plans of coming back to rejoin my family's business, I stayed on in Valencia, this time on the east coast of Spain, a great city, where I helped 𝐷𝐵IM grow, right from strategic partnerships to fundraise process. And last year is when my wife and I decided to come back to rejoin Mahajan Imaging Labs now. So that's been my journey.
A very long journey, a very global journey, but in a gist that you just mentioned. So it's been Mahajan, then 𝐷𝐵IM, and then again Mahajan.
Absolutely, yes.
Right. And see, I'm sure that since you very smoothly mentioned how has the transition been, you've been into, so you had a nudge for AI from the start. You although, have a background of radiology since this family business. But I'm sure that no journey is without roadblocks and challenges. You would have had your own set of challenges. So would you like to mention a couple of them for our audience?
Sure. So I will start with and maybe refer only to the challenges during my role at the startup in Spain.
Right.
So it was very different from running a a legacy business in India, and now I'm on the other side. Now I am pitching to radiologists, to health systems, to healthcare providers all over the world, and also to equipment vendors for strategic partnerships. So it's a very different mindset, and I think the experience I had on the other side really shaped me in my current for the current role that I have with Mahajan Imaging. But to talk about some of the roadblocks in a new field which is growing, such as artificial intelligence, you know, at one point of time we are first convincing the customer, which is usually the radiologist or the CFO or CEO of a hospital or large health system. First we need to convince them about a certain new technology that is coming in and how it will add value to that. So we are convincing them about the concept of artificial intelligence within medical imaging. The second thing that we had to convince was about the credentials of the startup that we had. Now, we were a team of 15 when I joined. Luckily, we had a lot of research experience. We were based out of a large 1,000-bedded public hospital in the Valencia region. But to build that credibility and convey it to the customers and the potential customers was a challenge. And that's where, you know, I faced a lot of pushback from the customers. And the third thing is that you have to convince them and show to them that your solution works and it is adding value to the daily clinical routine of the radiologist. So this journey, I mean the sales cycle for selling a new product was very long, and that I think all founders and all people working in new startups need to recognize that it will take time before you can get inside and even convince a hospital or a diagnostic center to run a pilot. So this was a big challenge that we had, and also for me, coming from a time where we were buying equipment, we were buying software, so you know they say customer is the king. So and now I'm on the other side selling our solutions to the same people who were at one point of time selling their equipment to me. So that was a big change in the mindset for me. But really, it's a fantastic experience. But yes, I mean, this was one of the biggest challenges. Of course, apart from that, living in a new country, it's a fantastic place, Spain. But still, to work in a new environment, it took some adjusting. But I was lucky to have a great team, and I could overcome all those challenges.
No, sure. And anyways, as long as you don't dive in practically into the field and get into a sales cycle, never then you know that how actually the pain goes behind, you know, setting up everything.
Oh, absolutely. I think the biggest learning for anyone is to try to sell something.
Exactly.
I mean, it really showed me how much it takes to get money from someone, and so that to me is the biggest learning that I've had. And you know, also being working in a small sort of company with big ambitions. It took a lot to try to convince 𝐔𝐻 Healthcare or Philips Healthcare or Fujifilm, with whom I was trying to do partnerships. It also I learned what it takes to partner with a big giant as a small and growing startup.
No, absolutely. I think at the end, all it matters is what difference is actually your maybe solution or your product making in the lives of, is it a clinician or a layman? So as long as you're clear with that fact, I think you have that resilience to go on and just, you know, build in the same way. Now, I very much like the fact you said that it's a legacy business that you've already seen. No, needless to say, Mahajan Imaging Labs has been the industry player since so long, and Dr. 𝗲𝗃 Mahajan has been there at the forefront, and now he's one of the veterans in the industry. But talking about it, now radiology has been in India since long, and there is no doubt in saying that actually Dr. Mahajan introduced how radiology businesses can grow, and then it went into a series and chains of labs. But integrating AI into it is a kind of a deal, and that's something that still I would think it's safe to say that our country is still exploring that. Can you provide an overview of how AI is currently being leveraged specifically in the radiology business? And number two, what opportunities do you foresee for, let's say, the budding ideas to come with?
Sure. So firstly, thanks for the kind words. That really means a lot. So AI in medical imaging, I would like to break it down into two key aspects. One is the non-clinical or operational aspect. The other would be the hardcore clinical aspect, where you are making treatment decisions based on that. So on the operations side also, in fact, that is where we have seen a lot of adoption, at least within our group at Mahajan Imaging Labs, where we are already using some solutions that enhance productivity of our technologists and optimize the efficiency and the turnover of the machines that we have. An example would be a artificial intelligence system that is embedded into a CT scan device that automatically positions the machine as based on how the patient is lying down. So typically the technologist would have to adjust the patient, but in this case the machine detects the positioning of the patient and adjusts itself. So that is a very small but very important use case on how we are using artificial intelligence, and it's a fairly busy high volume center. So even a minute or two time saved per patient means a lot to us. On the other side, we are also seeing and we are testing applications that again can reduce the time taken for an MRI machine. So we are testing a number of image enhancement algorithms that actually claim to reduce the time taken for a scan while providing the same or even better image quality, so that the radiologist is not disturbed with any loss of image quality. So that is also great, because if we can save 5 or 8 or 10 minutes per MRI scan in a country like ours where the reimbursement rates are a challenge, doing more on the same within the same hours is essential. So this is another sort of operational technology that we are testing. On the other side, as far as the clinical AI is concerned, we have deployed and are testing a number of tools. One example would be for chest X-rays. Now we have implemented technology where really we don't need a radiologist to review a normal chest X-ray. So if a AI says that the chest X-ray is without any abnormality, then we are very, very confident that there will be no abnormality, and that can be automatically reported, or just a very quick review by a human, and they can sign it. So this allows our radiologists to focus on the more complex scans where human intervention is needed. Also, we are now testing out a solution for prostate MRI analysis. Prostate MRI is a fairly complex study to acquire and also to report. So we are testing that technology, which can in fact claims to detect cancers automatically on prostate MRI scans. So these are some of the ways, but it's essential to integrate any new technology, whether it's operational, whether it's clinical, within the workflows of the radiology department or the hospital. Otherwise, it will have to be a very, very big claim and a very huge value proposition for a radiologist to switch over his or her style of working. So that is very essential. But these are some of the tools that we are currently testing and have tried.
Right. So thank you so much for that, Kabir. Now, since we're talking about AI, we're talking about radiology, imaging, etc., we are also focusing on the fact that there are so many ideas, and at the first place, there are so many opportunities, there are so many problems that are yet unsolved that probably AI has the tendency to solve. But keeping in consideration that the Indian healthcare industry has a very resilient regulatory system, there is a lot of Hudson processes that needs to be followed. So how do you see the regulatory landscape evolving concerning the integration of AI in, and not just radiology, but healthcare overall, and how does the regulatory compliance play a role in the widespread adoption of the technology?
Sure. So here, just to give a context, there are more than 500 applications of artificial intelligence that have been approved for clinical use by the FDA till now, and this number is growing on a daily basis. A lot of these technologies are developed by startups. FDA is relatively lenient towards startups, whereas if a GE or a Philips or a Siemens were to introduce a technology, they will be more robust just given the sheer scale and their market presence. So FDA has cleared about more than 500 applications, and even in India, the regulators have woken up to AI, and there are guidelines available for registering as a medical device for any new software, be it AI or be it non-AI. Why should AI be treated separately than a software? So the government, the regulators have woken up to this, and we are seeing more and more AI companies and in fact quantitative imaging companies come into India, and actually many of them are also acquiring data within India to develop India-specific solutions. While that currently is not mandated, but that will only add value and add to the accuracy. So definitely the regulators are aware, and we are seeing great progress.
Absolutely, absolutely. And since you already have an experience of dealing with regulatory bodies, both at the since you have an experience at setting up probably a startup in Europe and also now in India. So, of course, since it's a robust regulatory landscape, there is much I think that could be explored yet now. Diving a little from healthcare, or I would specifically say radiology or imaging. Now, since our conversation has totally been about technology, what piece of technology are you currently eyeing on, be it healthcare or non-healthcare, that you think has still the capability to probably be explored on a larger level?
Sure. So obviously I'll have a bias towards healthcare, specifically radiology technologies. What we are looking for, and what a country like India or even many countries in the West need is for radiologists and pathologists. Even in the US, even in the UK, there is a huge shortage of trained radiologists or histopathologists, as an example. So what we believe AI will do and what we are looking out for is solutions that will enhance productivity by 10x or 15x. Not give an incremental benefit of 10% or 20%. That, especially in a country like India, has very limited value. But if a radiologist reporting, say, 25 or 30 MRIs in a day can report 500 or maybe even 200 in a day at the same level of quality, that is where value of AI solutions will be realized, because India especially is so grossly underserved, and this is how technology and imaging technologies can be taken into the remote areas of the country. So this is what is our dream. We do believe this will happen in the coming years. Already we are seeing for chest X-rays and for fracture detection on X-rays that there are very robust and very accurate technologies available that can screen at a population level as well. So that is what really we need. Outside of healthcare, honestly, I'm not a very big technology geek, but I've been using ChatGPT to write content, and in fact even to some of the...
ChatGPT is an invention.
It is. And in fact I've been, I shouldn't say this, but I've been using it to apply to some of the awards that are there, and luckily we won a few, so it seems to work.
Good luck with that. No, you very rightly said that considering the burden of healthcare in India, it's very, very important to address the fact that we really need to scale up the screening and diagnosing, let alone treatment side of it. But of course, to all the public forums, we always talk about how there is a problem in accessibility of certain set of diagnosis or treatment. But at the first place, there is still still a much needed potential of scaling up how probably these screening options can go and penetrate into probably the more complex parts of it.
Absolutely, and there is a lot of great work happening in India. There are startups working with handheld X-ray devices along with the AI platform, and they are going in the remotest of areas and screening for TB. And in fact, the WHO has authorized AI technology on chest X-ray for screening of TB. So that is how value of AI will be realized, because you can never have enough radiologists to report a TB X-ray. So this is the way also to triage, and it's a great way to screen. Similarly, we would hope that the government would take up mandates for breast cancer screening, for lung cancer screening, and in fact more and more as we are moving towards urbanization, prostate cancer screening is the need of the hour. So we would hope similarly there are population level screening programs for that, thanks to artificial intelligence.
No, yeah, you rightly mentioned that the way India has taken the initiative to eradicate TB, it's the goal of 2025. I don't know what is the landscape of it right now. We really wish, considering the burden of now breast cancer, cervical cancer, there is, I mean, we really need, and there is a scope of getting the timely screenings done. So yeah, I mean, we really wish that there are new interventions addressing that. Switching on, just we are towards the conclusion of this entire discussion, so I would just request you to give a piece of advice to all our viewers who are probably founders or entrepreneurs.
Sure.
From your experiences.
Sure. So I'll wear my startup hat during my days at 𝐷𝐸𝐵, and I think it is most important to realize, to be transparent with your team members about at what stage your product or technology is at. And secondly, it is very, very important to select the right partners for the initial pilots and feedback. While you will want to partner with the best and the largest system for a pilot, it might not always work, because the larger the health system or the hospital, the more complex it is to get inside the system and try to integrate your technology. So I think it is very, very important to select the right partners for the initial pilots who will give you the correct feedback, and not just, you don't need positive feedback. You need ways of improving and how the product can be integrated in the workflows. So you need really to select the right visionaries and the right kind of pilots to start. And like I said, it is very essential for the founders and the senior management of a startup to be very transparent with their business development or sales team about at what stage the current technology exists and what is the roadmap. So these two, I think, are very, very critical in my experience.
Selection of the founding team and being transparent is, I think, the two keys that you
Selection of the correct pilots, initial set of customers.
Right. Then thank you so much, Kabir, for this discussion today. I'm very sure that the experiences and the anecdotes that I learned from you, our viewers might have gained an immense amount of knowledge and experience from it. Thank you so much to everybody who's joined in today. Thank you so much, Kabir.
Thank you so much.
It's been a pleasure.
Everyone is welcome to our facilities if they have the time.
Absolutely. Thank you so much, everyone.